Hi, beautiful people. How are you? I hope you're having a great day. I have a little bit of a different setup right now. My husband and I purchased two new computer screens. So I have one here and one right here. And it's helping me visually quite a bit with the print being extra large and the size of these screens being quite large is really nice. So I hope that you'll notice a little bit of a difference. Here's the list of the 8 types of fibromyalgia pain according to Very Well Health. I've begun to send out surveys for you to participate in. So make sure you click on the bell and get all notifications of when I put out new videos and messages that I send from the community tab, including those surveys. So I'm putting out a survey for each of the 8 types of fibro pain. My phone is making noises. They're easy to answer, just a yes or no as to whether you have a specific type of pain. I think it'll be fun to see the results and discover how much we have in common. Today's video is the last one in the series on the 8 types of fibro pain. We're going to talk about pelvic pain today. You can find all of the types of fibro pain in the community tab and under the playlist called Types of Fibro Pain. So here we go. First of all, fibro is a common condition found in about 10 to 12% of the human population that is present in all countries. Additionally, it's common for patients to suffer with pelvic pain. Most patients with chronic pelvic pain carry multiple diagnoses. Fibromyalgia and chronic pelvic pain syndromes and symptoms are common, such as bladder incontinence, urinary frequency, dysuria, painful sexual intercourse, and interstitial cystitis. Chronic pelvic pain is pain in the area below the belly button and between the hips. A 2011 study, researchers stated chronic pelvic pain is defined as intermittent or constant pain in the lower abdomen or pelvis of at least 6 months duration, not occurring exclusively with menstruation or intercourse and not associated with pregnancy. Patients with chronic pelvic pain may have sexual, bladder, or bowel dysfunction, as well as generalized symptoms. Chronic pelvic pain is a symptom, not a disease, and can result from many different entities, which we're going to discuss today. The symptoms may come and go, but may be dull aching, may be serious and steady, contain sharp pains or cramping, and there may be pressure or heaviness deep within the pelvis. Pain can occur during sex, while having a bowel movement or while urinating, or when you sit or stand for a long time. So from mild chronic pelvic pain to pain so intense that work is missed and sleeping or exercising is impossible. Lastly, other symptoms involve bloating, upset stomach, constipation or diarrhea, and/or an urgent or frequent need to urinate. Chronic pelvic pain is common in women in general in the US at a rate of 1 in 7 women. Wow. About 93% of women with fibromyalgia indicate they experience bladder or pelvic pain at least occasionally, with more than half reporting that they experience discomfort on a usual basis, according to a 2015 study. Fibromyalgia can cause so many pain issues all over the body. Pelvic floor soreness often involves the muscles in the pelvis that are not relaxing normally. The muscles stay tight, become tender, and cause pain. Chronic pelvic pain can result from the reproductive organs, but it isn't straightforward sometimes. The pain can come from our bladder, our gastrointestinal system, our nerves, or our pelvic muscles. And even our hip muscles or abdominal wall muscles can be the issue. So physicians will investigate to which of these are misbehaving. In a 2023 study, pelvic floor dysfunctions were significantly higher in women with fibromyalgia compared to healthy women. It was stated that women were 2.6 to 2.9, or almost 3 times more likely to report mixed urinary and anal incontinence than those in the control group. The most common conditions in women with fibro and ME/CFS are endometriosis, dysmenorrhea, vulvodynia, and uterine fibroid tumors. In men, the common issues are chronic prostatitis, also called chronic pelvic pain syndrome, penile or testicular pain syndromes, and post-vasectomy pain syndrome. In men and women, pelvic floor dysfunction, as well as painful bladder syndrome, also called interstitial cystitis, IBS, a topic in our last neuropathic pain condition discussion, and chronic kidney stones and nerve damage, as in neuropathy, are also common in fibro. Why are all of these conditions linked to fibromyalgia and ME/CFS? It's believed that they're all in the family of central sensitivity disorders, which involve abnormalities in our brain and nerves that make us extremely sensitive to a variety of things like pain, temperature, and sound. So these are the conditions that I would like to discuss today. I'll try to be brief with each one because the list is quite large. Here we go. In women, endometriosis is a painful condition in which the endometrial tissue grows outside of the uterus. I know someone who had this condition since she was a teenager. Oh, and I remember as a teenager, she suffered so much. Clear into her adulthood. In a 2019 study, women with endometriosis were 6% more likely to have fibro than women without it. Treatments for endometriosis include hormonal therapies, complementary therapies, lifestyle measures, and in some cases, surgical procedures, including hysterectomy. And that was what my friend ended up having done in her late 30s. She was never able to get pregnant, unfortunately. Vulvodynia is vulvar pain of at least 3 months' duration without a clear identifiable cause, but is most likely caused by inflammation of the vulva, damaged or irritated nerves, long-term infections, genetic disorders, sensitivity to specific foods, dysfunction of the muscles of the pelvic floor, or conditions that affect nearby muscles or bones. It causes burning, stinging, irritation and rawness in the affected area. Swelling, aching, soreness, and throbbing may also be present. Dysmenorrhea is the medical term for painful menstrual cramps. It's more common in women with fibro at 71% and ME/CFS than those without. The pain can be mild to debilitating and occur in the lower abdomen, lower back, and radiate down into the thighs. Primary dysmenorrhea, that which is not caused by another medical condition, can increase the risk of fibromyalgia and other chronic pain disorders later in life, according to a 2015 study. How many of you can say that you experienced dysmenorrhea in your younger life and now have fibro? I can. I don't think I ever correlated fibromyalgia with my dysmenorrhea issues. I think it's because I considered those painful cramps and such just a part of life, something that I had to deal with. Do all women with dysmenorrhea get fibromyalgia? Of course not. It's a risk factor if all things line up. In addition, if you have fibromyalgia, your menstrual cramps are probably worse. Treatment involves avoiding alcohol, caffeine, and reducing stress. Also, don't smoke during menstruation. Increase your physical activity and take B1, omega-3 fatty acids, and magnesium supplements. But always talk to your doctor, and your doctor may have other medical treatments that can effectively treat dysmenorrhea. Uterine fibroid tumors, also called leiomyomas or myomas, are common in some women with fibromyalgia. A 2021 study found that about 76 to 77% of women with fibromyalgia have myomas. These aren't cancer and almost never turn into cancer. You usually don't have symptoms, and many women will have them during their lifetime. They will usually die on their own. So, over time, they just go away. I had one in my teen years, and my doctor put me on birth control because I was having a lot of symptoms, which we're going to talk about. So see your doctor if you have pelvic pain that doesn't go away. You have heavy or painful periods that limit what you can do. You have spotting or bleeding between periods. You have trouble emptying your bladder, or you have ongoing tiredness and weakness, which can be symptoms of anemia, meaning a low level of red blood cells. In men, chronic prostatitis, or chronic pelvic pain syndrome, is defined as the absence of identifiable bacterial infection as a cause for the chronic pain, sexual dysfunction, and urinary symptoms. In the general population, about 8.5 to 25% male adults have reported chronic prostatitis. In fibromyalgia, the prostate is tender, but other symptoms may include pain in the lower back. There's pain in the genitals, frequent urination, pain that gets worse with prolonged sitting, painful urination or bowel movements, worsening pain during sex, or erectile dysfunction. Penile or testicular pain syndromes can be caused by conditions that your doctor may want to rule out. Pain can start in the groin, stomach area, or somewhere else. For example, kidney stones and some hernias, or perhaps a UTI, diabetic neuropathy, or inflammatory prostatitis can occur. But there are times that no cause can be found, called idiopathic pain. Post-vasectomy pain syndrome is chronic pain after the surgical procedure called vasectomy. And treatment for these male conditions include over-the-counter medicine and a heating pad as the most common treatments. Many patients get evaluated for food sensitivities, since it's reported in about half of patients that certain foods aggravate their symptoms, such as spicy foods, coffee, hot peppers, alcoholic beverages, tea, and chili. However, 22% of patients find their symptoms become alleviated with water, herbal teas, psyllium, docusate, and polycarbophyll. But always talk to your doctor. Perhaps there are prescription meds that will help, or physical therapy, but the best treatment option is often uncertain because it's different for everyone. In men and women, it's common to have pelvic floor dysfunction. This is the inability to correctly relax and coordinate pelvic floor muscles to urinate or have a bowel movement. Symptoms include constipation, straining to have a bowel movement, to urinate, or stool leakage, and experiencing a frequent need to urinate. In a 2014 study, women with fibro reported having 50% greater pelvic floor symptoms compared with matched women without fibro. And in a 2015 study, women with fibro reported significantly more bothersome pelvic floor and urinary symptoms. Pelvic distress and urinary symptoms were associated with more severe fibro symptoms. As a side note, many studies involve the participation of women with fibro because of the male to female ratio, but this is also a problem for men. Treatments include biofeedback, pelvic floor physical therapy, and medications. Interstitial cystitis is a chronic condition that causes the bladder walls to become inflamed and sensitive, which indeed causes pelvic pain. About 39% of women with fibro are diagnosed with interstitial cystitis. IBS, a topic, as I said from our last neuropathic pain condition, causes abdominal pain and cramps, which can often be felt in the pelvis in men and women. About 80% of people with fibromyalgia are diagnosed with IBS. People with fibro may experience chronic kidney stones. I have a friend with fibro who experiences those. Terrible. These are hard deposits of mineral and salts that form in the kidneys and can cause severe pain, nausea, vomiting, and infection. Pain and a stinging sensation during urination can be caused by these kidney stones. Many people have a long history of producing kidney stones. Nerve damage, as in neuropathy, is not a new topic for us. We've discussed this multiple times. But for this video, we're specifically discussing pelvic pain. In a 2019 study, researchers stated that patients with complex pelvic pain were positive for small fiber neuropathy. They also experienced the other chronic conditions, such as fibromyalgia at 38%, endometriosis at 15%, IBS at 33%, GERD at 46%, migraine at 38%, interstitial cystitis at 18%, vulvodynia at 5%, and other chronic pain conditions at 36%. Overlapping pain conditions are remarkably high, with chronic pelvic pain conditions and small fiber neuropathy. If you're in pain, It might seem logical to get lots of rest. This is what people were advised to do in the past. Nowadays, people with chronic pain are advised to stay physically active and get regular exercise. When you exercise, your body releases substances that have a pain relieving effect called endorphins. Endorphins also help to relieve stress, and new research shows that it reduces neuroinflammation. Exercise also improves our blood circulation and stimulates our metabolism, making sure that our bones and cartilage get enough nutrients. It has other advantages too. Exercise improves our physical resilience, our ability to move, and our sense of balance, which can help to prevent falls in old age. I need that. I don't fall, thank goodness, but I do have a pretty wicked balance problem. Last but not least, it can improve our well-being. People who aren't used to exercising should start off slowly to avoid overdoing it. We can find out what type of exercise helps us by either trying out different things ourselves or as part of an exercise-based treatment. Personally, I think we need to find what works best for us. Our bodies are built differently, and what works for me may not work for you. We've discussed so much in this video today. I hope I didn't overwhelm you. Please leave a comment below and share your thoughts and experiences with us regarding pelvic pain. Because as you've learned today, it's common among us. I hope you learned something. I send you gentle hugs and support. Love you.